it's causing it. These people are deliberately stressing his heart to the point of collapse. If they succeed in bringing on a cardiac arrest, it will be the second assault on Harry Edwards' heart. He suffered a heart attack just over a week ago. Today's controversial test, done under a local anaesthetic, may require him to relive that frightening and dangerous experience. But ironically, threatening his life in this way may well save it.
Can you see the screen there, Harry?
I did turn it.
Yeah, okay, I'll show you in a moment, actually, when we get the next one in.
While it's an obvious relief to survive a heart attack, for some it can be a prelude to a second, often fatal, heart attack or cardiac arrest. Although we tend to lump those terms together, there is a difference.
Okay, I'll come off again there now.
A heart attack occurs where a clot or blockage in the blood supply to the heart causes part of the heart muscle to die. A cardiac arrest is due to an electrical disturbance in the heart that prevents its pumping action, causing for thousands of Australians a year sudden death. For every 100 patients who leave the hospital following a heart attack, approximately 6 will die from one or the other within 12 months. To assess a patient's vulnerability to a further heart attack, it's routine whilst recuperating to undergo an exercise test. A clot or blockage in the artery will be evident on the patient's ECG. A bypass operation or medication can correct the problem. But that's only half the story. 50% of those likely to die have damage to the heart that can't be detected this way. They're at risk not because their arteries are blocked, but because the heart's electrical wiring has been knocked out of kilter as a result of that first heart attack. For the heart to beat, the sinus node at the top of the right atrium initiates an electric current, which passes through the AV node into specialised conducting tissue in both ventricles. After a heart attack, scar tissue can form in the left ventricle that may disrupt the dispersal of the current. In most cases, the current simply follows the edge of the scar and continues along. But for about 1 in 10 heart attack victims, the current may get caught up in the scar and form a short circuit. This means the major pumping chamber of the heart will not beat effectively and could lead to cardiac arrest. Today, the cardiology unit at Sydney's Westmead Hospital is testing Harry's heart to see if any faulty electrics have left him prone to sudden death. This is Harry's normal heart rhythm, called sinus rhythm. What the doctors intend doing today is adding extra heartbeats where they shouldn't be. In effect, they're trying to push Harry's heart into overdrive. When that happens, they'll be looking for one of 3 possible responses. Firstly, and hopefully for Harry's sake, there'll be no change at all from the normal pattern of his heartbeat. The other 2 responses involve a change in this pattern. One of them, any normal person undergoing this procedure could experience fibrillation, which is the chaotic and unordered beating of the heart. This could lead to Harry experiencing a cardiac arrest today, but ironically, in the long term, fibrillation is good news. The one that indicates there's been some electrical damage to the heart is called ventricular tachycardia, and this is where Harry's heart will beat so fast that it just can't cope. Technicians in an adjacent room will pace Harry's heart through 3 wires that have been fed into the heart via an artery in the groin. They begin by pacing the heart slowly, and then after 8 beats, they add 1 extra beat.
Intermediate.
No abnormal rhythm so far, so a second extra beat is added, and Harry starts to feel it.
It feels different, yeah. It feels like there's something leaning on my heart. Oh, on my chest. I don't know about my heart, but on my chest.
Unpleasant?
No, not really, no.
Third extra.
3 beats are added. Harry's still lucid and not feeling pain, but he's a little short of breath.
Explain. If you've been working a little bit harder than what you should have been, that's all.
Slightly puffed, maybe.
Yeah.
Only been for a short time, so
They give him an oxygen mask to make breathing easier.
4th extra.
4 beats, and after several minutes, Harry's heart goes into an abnormal rhythm.
Count for me, please, Harry.
Big one.
Just start counting for me.
A bit dizzy here for a moment, Harry. Yeah. Just start counting for us. No, that's all right. Yeah, you're right. It stopped again. Can we just count how long that was?
His heart is beating normally again, but just as it recovers, it goes once more into a fast, chaotic rhythm, this time causing him to lose consciousness. A cardiac arrest.
Just count, Harry. Okay, keep counting.
Keep counting there, Harry.
Clear.
Good.
A jolt from the defibrillator brings him around.
Harry, it's
You're
okay.
back to normal
It's
now,
okay.
mate. You passed
It's all
out for a
right.
few seconds.
That's it.
You
It's
passed
all right,
out for a
Harry.
few seconds. You're just having your test here in the hospital. You were out for about 5 seconds there, and you're all back to normal now. Everything's fine, and everything's back to normal, and the test's all over.
Chest might feel a little bit sore.
It was good news too. It all looked great. That blackout that you had at the end is the kind of thing that can happen to me or anybody having this test. We were really stressing your heart pretty hard to see if we could start up any fast rhythm, and that kind of result we got then isn't a serious problem. So really the result, the test today, is a great news. It means that your chance of dropping dead suddenly in the next year or two is extremely low, pretty close to zero. So that's good news for the future.
Yeah, it is, yeah.
Yeah.
At least you know.
That's right, exactly.
That was the idea to find out.
For those who aren't as lucky as Harry and test positive for tachycardia, the news isn't all bad. Although their heart's wiring has the potential to short circuit, there are several treatment options available to them. One of these options is the implantable defibrillator. Defibrillation is the administering of an electric shock to reset the heart's electrical rhythm, and it's usually done with a unit like this. But advances in recent years have turned this into this. A self-contained unit that's small enough to be implanted inside the human body. It's like having your own personal team of paramedics. This lead sits inside the heart and it constantly monitors the heart's activity. When it detects an abnormal rhythm, these pads that sit either side of the heart will deliver a small electric charge, just enough to regulate the beat. And if that doesn't work, the pads will act like the paddle on the larger defibrillator and give a life-saving shock. So whatever the result, the team at Westmead argues that it's better to know than not. Over 1,500 people have been tested this way, and despite the frightening nature of the procedure, they claim it's safe. Previously, people like Harry would have been subjected to various drug regimes, just in case his heart did have a short circuit. But now he can rest comfortably, knowing he faces a future free of drugs and cardiac arrest.
Real pleased.
Later, the phenomenon we call wind shear. And next, power to the people. It marks the return of the village blacksmith.